We all know that a nutritious diet is key to keeping healthy, but to monitor the impact of diet on our health, continuous studies are needed. The Nutrition Society provides scientific, evidence-based research for the public health community, helping to bring nutritional education and change. Donna Bernard went to meet the team.
The Nutrition Society disseminates nutritional science, providing the evidence base for policymakers, healthcare professionals and practitioners.
It's really important when we think about dietary policy or giving some advice to people that it is evidence-based. There is a lot of confusion in the public in relation to what's the best diet for them. And I think it has to be delivered by those that are trained in nutrition.
Well, I'm a nutritional scientist, and what we do as nutritional scientists is research, and then we publish our research after it's been subjected to quite stringent peer review, and publish in journals such as those that the Nutrition Society publishes.
Associate Professor of Obesity Dr. Bernadette Moore's study on breakfast cereals and yogurts led to some surprising results.
Many of us still make the mistake of believing that yogurts and cereals are naturally healthy foods. But if you take a look at this label, for example, it has 13 grams of total sugars, of which 8 have been added.
I was really shocked to see how much sugar there is, particularly in cereals targeted to young children and weaning children.
Research studies like this are then shared with government bodies like Public Health England.
Public Health England manages risk. They have campaigns like the Change for Life campaign or Sugar Swaps, where they're trying to influence people's diet. And the Nutrition Society is really important in relation to providing evidence for this.
Professor Parveen Yaqub focuses on the effects of fatty acids on inflammation and immunity.
There's clear evidence that nutrition is important for immune function, because if you look at developing countries and places where there are food shortages, there's a clear connection between malnutrition and the incidence of infections. I've been doing studies testing the effects of fish oil, which is rich in omega-3 fatty acids, on various aspects of immunity and inflammation.
Patients at risk of stroke were given fish oil capsules 2 months before surgery. Then plaque tissue from their neck arteries was analysed after surgery.
The patients who took fish oil had a change in structure of their plaque in the carotid artery, and the indication was that the plaques became more stable in the patients who were taking fish oil compared with those who weren't.
The impact of diet on surgical outcomes is something that's been noted by doctors working on the front line in hospitals.
We're now aware that the minor and major complications from surgery are dramatically reduced if before surgery we can optimise nutrition.
Dr. Nagibi's speciality as a gastroenterologist includes ensuring that patients have the best possible nutritional advice before and after surgery.
I think the Nutrition Society has a wide remit where it can connect those researchers in the field of nutrition and clinicians like myself.
There's a growing feeling that nutrition needs to be a fundamental part of medical training.
I was 4 or 5 years into working as a doctor when I started taking a special interest in nutrition as a subspeciality of gastroenterology, and really it felt like going right to the beginning again, because there just wasn't that background and foundation to build on.
I think it's essential, and that is because it is now apparent that so many of our chronic diseases are directly linked to nutrition, or rather poor nutrition.
The Nutrition Society has a wide remit to communicate robust nutritional science to policymakers, clinicians and healthcare professionals, ensuring the public receives evidence-based nutrition advice. As nutrition and lifestyle-related diseases continue to rise, this could prove essential in helping to manage the nation's health.